boys and girls, welcome to Malaika News. I'm your host, Israela. Seems like there's no other news than COVID-19. That's what everyone seems to be talking about nowadays. So, what is COVID-19 and what does it mean to children? COVID-19, or the coronavirus, is a communicable respiratory disease caused by a new strain of coronavirus that causes illnesses in humans. If you're wondering why the number 19 is there, it's because it was discovered around December 2019. Scientists are still learning about the disease and think that the virus began in animals. At some point, one or more humans got infected from a bat, and they began infecting other humans. It spread from person to person through infected air droplets like when you sneeze or cough and in the saliva. It can also be transmitted when we have contact with hands or surfaces that contain the virus and touch the face, meaning nose, eyes, and mouth. The virus was first reported in Wuhan, a city in China, but now it has spread throughout the world. Most people infected with COVID-19 virus will experience mild to moderate respiratory illnesses and recover without requiring any special medicines. Currently, there is no vaccine for COVID-19, but the recovery rate stands at 85%, which is pretty good and should put us at ease that this is not a death sentence. Older people, however, 65 years and above, and those with medical problems like heart disease, diabetes, respiratory disease, and cancer are more likely to develop serious illnesses. The most common symptoms of COVID-19 are dry cough, fever, and tiredness. It's important to note that anyone can catch COVID-19 and become seriously ill. People of all ages who experience fever and or cough associated with difficulty breathing, shortness of breath, chest pain, pressure, loss of speech or movement should seek medical attention immediately. If possible, it's recommended to call the healthcare provider or facility first, so that the patient can be directed to the right clinic. The best way to prevent and slow down the transmission is to be well informed about COVID-19 virus, the disease it causes, and how it spread. Protect yourself and others from infection by washing your hands or using an alcohol-based sanitizer. Rub frequently. Not touching your face. Observe social distancing when out and about, which should be at least 1 meter. Wear a face mask when out in public places. Stay at home. So, are children and teenagers at risk? Evidence to date suggests that children and young adults are less likely to get the severe disease, but severe cases can still happen in these age groups. Children should follow the same guidelines on self-quarantine and self-isolation. If there is a risk they have been exposed or are showing symptoms, it is particularly important that children avoid contact with older people and others who are at risk of more severe diseases. On how to properly wash our hands, let's see how our friend Zawadi does it.
Well, I wash my hands a lot because it helps in stopping the spread of the COVID-19. Please wash your hands properly for at least 20 seconds, and if you're not sure what 20 seconds is, then you may use my song. I wash my hands, you wash your hands, so we can stop this COVID-19. I wash my hands, you wash your hands, so we can stop this COVID-19. I wash my hands.
Thank you, Zawadi. That was very creative of you for using a song for exactly 20 seconds while you wash your hands. Remember, it is recommended that you wash your hands for at least 20 seconds for them to be clean. Okay, boys and girls, that's it for today's news on COVID-19. I hope you've all understood what it is and how it's transmitted and how to stay safe and keep others safe. Next week, we will report on the stress that COVID-19 has put on children and what they can do to reduce the stress. I'm your host, Israela. Goodbye. See you next time.